Hi there. I'd like to introduce Nancy Mather today. She's going to be talking to us about learning disorders. She's an expert in this area, and she's also co-author of the Woodcock-Johnson, a test that we often refer to. She got her original degree from the University of Colorado and a teaching certificate there, and then she went on to get her master's in education from the University of Northern Arizona in Flagstaff, and she's got her PhD from the University of Arizona. And she's currently a professor here at the University of Arizona. She's published lots and lots of articles. She's been an expert witness, and please welcome her today. Thanks.
Great. Thank you. I'm from the College of Education. It's nice to be in a different place for a little bit. So today I'm going to talk to you about learning disabilities, and if you were going to take courses in learning disabilities, you could take 5 classes. And so we just have 45 minutes, and so it'll just be kind of a quick overview of information regarding learning disabilities. Before I start in, this summer, went to the Maldives. I didn't even know where they were before, but it's like in the Indian Ocean, and it's like these little kind of resorts. So there's like thousands of these little islands and resorts and things like that. And you can really see global warming happening there. But one of the things that we did when we were there is screen the children for vision and hearing and attention problems and things like that. And it was the first time that a lot of them had ever been seen for hearing problems or vision problems. And it just made me think about, in this country, how far we are in terms of helping children with different kinds of problems. I mean, we know so much about learning disabilities and things, and this was the first time many of these children had even been seen to see if their hearing or vision was okay. So it was quite an adventure. Now, I put for you just in the handouts there an article on learning disabilities that I thought you would find interesting. Just gives a nice overview of learning disabilities from a clinical perspective, and has a lot of good information in it. So if we think about what are the most common learning disabilities, now dyslexia is the most common learning disability. About 80% of children referred for learning disabilities have dyslexia, a specific reading disorder. There are also children with dysgraphia that have writing disorders. They have a lot of trouble writing, and their spelling is very poor. Into adulthood. And then dyscalculia, we have a subset of children who are really struggling learning math concepts. So essentially, learning disabilities are referring to pretty severe problems in developing academic skills. I'm not going to spend very long talking about what happens in public schools, because it's not the same as what happens in terms of identifying learning disabilities. But the schools are influenced by the Individual Disability Education Act, and that's where the disability categories are explained. So the latest reauthorization was in 2004, and this is the definition in there for learning disabilities. So they say it's a disorder in one or more of the basic psychological processes involved or in understanding using language, results in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. And it tells it includes brain dysfunction, dyslexia, developmental aphasia, and it doesn't include learning problems that are primarily the result of visual impairments, hearing impairments, mental retardation, emotional disturbance, etc. So this definition has been in the law since the 1960s and has never changed, even though we know quite a bit more about learning disabilities than when this definition was written. So under the federal definition, there's 8 areas a child can qualify for services in a public school. So these are the 8 areas that the child can qualify. They just added a new one with the reauthorization, which is reading fluency. So oral expression, listening comprehension, written expression, basic writing skill, reading fluency, reading comprehension, math calculation, and math problem solving. Okay. So one of the things, again, about the law is this exclusionary criteria says that the problem cannot be because of these other things. So it can't be a problem in terms of an intellectual disability or cultural disadvantage, etc. So in the schools right now, there's two different methods for eligibility for children to get services. One is an ability achievement discrepancy, where they compare an intelligence test to an achievement test to see if you're far enough behind. And another is a new procedure that they're calling response to intervention, that the child's not responding to treatments, and so then again you would say, well, he probably has a learning problem if he's not responding to treatment. Okay. Now, a lot of children that really do have learning disabilities aren't going to be identified in public schools, as a reality. And so they may not receive services even though they really do have learning disabilities. Okay. So again, the two identification procedures in the schools right now, one is a severe discrepancy between your intelligence and your achievement. So this is attempting to quantify unexpected underachievement, that you would think the person should be doing better than they're actually doing. And then the other is responsiveness to intervention, RTI. And so this is a new procedure they're starting in schools, where they screen all the children in the schools to identify potential problems. Then they identify the at-risk students, they implement interventions, and they monitor their progress. And then those who don't make progress are referred for more intensive interventions, essentially. Okay. But then again, if we think about learning disabilities, oftentimes are associated as well with attention deficit hyperactivity disorder. And so some people estimate that the comorbidity between these two disorders is about 40%. So you'll see a lot of children who have attentional problems as well as having trouble in reading and writing and math. But with learning disabilities, again, the belief is that there's some kind of psychological processing problem, like in memory or perception or attention or motor skills, that's affecting your academic development. So it's affecting your reading, writing, or math performance. So again, we'll see with specific learning disabilities and attention deficit disorder that estimates in terms of overlap are 25 to 40%. And oftentimes, too, we find that there's a family history of, very similar kinds of problems. So here we have Zaro's dyslexic brother. Anyway, okay. And so I called you in to talk about your son's attention span. Mr. Sloan, Mr. Sloan, Mr. Sloan. But oftentimes, again, you do see that there's learning disabilities are genetic. There's a family history. So you will often have siblings or a dad or a mom or an uncle who's had similar kinds of difficulties in school. Now, just to kind of show you an example, this is just on the Woodcock-Johnson writing samples test, but this boy's in 4th grade. And the assignment was, he's supposed to say, this woman's a queen, write a sentence that tells what this man is. So you can see he wrote, the mom is thin. And then you look at the next one, he's supposed to write what was happening in the picture. So if you just saw this, you'd think, well, what's going on? But this is what he said when he wrote this. He says, the man's a king. Uh-oh, hard words. I don't know how to spell those words. The man is rich. Another hard word. I don't know how to spell rich. What do I know how to spell? I can spell mom and dad. The mom is a queen. Oh, I don't know how to spell queen. What do I know how to spell thin? Oh, I can spell thin. And with that, he wrote, the mom is thin. So you can see again this big discrepancy between this child's reasoning and language abilities and his abilities to put his thoughts on paper, just because he has so much difficulty with spelling. So I had the good fortune to study with the late Dr. Samuel Kirk, who is oftentimes called the father of the field of learning disabilities. I actually came to the U of A to study with him. He was one that actually made the definition of learning disabilities. But he said back in the 70s, he said, I'd like to define a learning disability as a psychological or neurological impediment to the development of adequate perceptual or communicative behavior, which first is manifested in discrepancies among specific behaviors or between overall performance and academic achievement. So that's back again in 1970s. And so you see these two concepts with learning disabilities. Discrepancies among specific behaviors. The child does some things very easily and then struggles tremendously with other things, as well as a discrepancy between overall level of language ability or intelligence compared to academic performance. So he also said this, though: a learning disability is like pornography. It's hard to define, but you know it when you see it. And you do get to the place where you do know it when you see it. Now, again, as I mentioned to you, the most common learning disability is dyslexia. And oftentimes, I'm sure you're going to have parents ask you if you think that their child has dyslexia, because that's the term that they will be hearing because there's so much publicity about dyslexia. Now, in schools, they don't call it dyslexia. They call it a learning disability or reading disability. But Newsweek many years ago had a cover story, and then more recently Time magazine had a cover story in terms of dyslexia. And so people hear the term a lot. Okay. I just want to give you an example of a boy with dyslexia. Now, this is Dr. Samuel Kirk, and we went to see this young boy, Charlie. And Charlie was in the 3rd grade. Now, this is what's considered a primer level passage, a very beginning reading passage. And I want you to just listen to Charlie read this. I hope. Okay, play.
One day before I walked in the park. Soon she was. Soon something a pretty party, and so I see a party when she was poorly and Polly and for
So you can see how much he's struggling with reading. He's in 3rd grade right now.
A pretty
And the school wants to retain him even though his math skills are a year above grade level. So he's had tremendous trouble learning to read.
Candy with it bared, and I will go with you, said Polly. Away went all.
So when he gets down to this bottom line, he reads away, then he reads went, and then he comes back.
Way they all went.
Okay.
Okay,
Let's see how I close this now.
abandon, zigzag, turn, thick.
That looks good. Okay. So several years ago, I was at a conference in Kilgore, Texas. I don't know if you know Kilgore, but this was the name of the conference, Reading is for All, Y'all, which is kind of cute if you live in Texas. But we really do want all children to learn to read, and kind of what they suffer in school when they have reading problems is just, it's, quite severe. Sometimes, again, dyslexia is very, very severe. It can be mild and it can be very severe, but we do know when children get help early, it does affect their prognosis in terms of success. Just as another example, this is a high school student. He's in 9th grade. And his teacher said, I just want you to tell me something about yourself. She was collecting work samples to see how the kids were doing. And he says, like me, I have a disability. I've had it since 3rd grade. I'm often quitting because of my disability. For example, I know how hard it is. I can't spell right. I've been trying for all my life. I know I'm afraid to write a note to my girlfriend. She doesn't know I have it. I don't know how to tell her because I don't know how she's going to act. I don't know why I'm telling you, but I know that I'm not stupid. So again, here's a boy that has very severe learning disabilities. It really had gone pretty much undetected, who hasn't gotten proper help. Now, if we kind of just look back historically in terms of the concept of learning disabilities, it's not something new. It goes back in terms of people being aware of these problems since the 1800s and writing about them. So back in 1902, James Henshelwood, a Scottish ophthalmologist, had a monograph called Congenital Word Blindness. So back in that time, dyslexia was called word blindness because it seemed like the person was blind to the printed word, even though they weren't really blind. And then they also had word deafness, which is like you're deaf to words even though you're not really deaf. But what he, 1902, was saying, he said, well, there's particular areas of the brain that appear to be involved, that the children often are smart in other ways and that they have a good memory, and that the problem with reading is very specific. It's not generalized to all areas of academic performance, and so not everything's impaired. Okay? And that these children don't learn to read as easily as other children do, and the sooner we help them, the better. They're going to need to be taught by special methods to overcome these difficulties. Using touch can help these students retain visual impressions of letters and words, and persistent and persevering attempts will often help children improve their reading. So this is back again in 1902. 1932, Monroe had a book called Children Who Cannot Read, where she did a very in-depth study of the children, and we see sort of the origins of the ability achievement discrepancy in this book, because what they did was they took the child's chronological age, their intelligence score based on the Stanford-Binet, and then their ability in math computation. They compared that to their reading performance to see if the person was behind what was predicted, essentially. So it says, it seems we're measuring a discrepancy between reading and other accomplishments which may occur at either direction at any intellectual level. The reading defects may occur at any intellectual from very superior to very inferior as measured by intelligence tests. So you can have highly intelligent children who have learning disabilities. And sometimes those children will not be identified in schools as having learning disabilities because they have average performance when you would expect them to be doing so much better. So she went on to say that children of superior mental capacity who fail to learn to read are, of course, spectacular examples of specific reading disability, since they have such obvious abilities in other fields. So many times, again, these kids are gifted in other areas, in science or in mathematics and other areas of performance. Well, well, if it isn't the guidance counselor who told me I'd never amount to anything. So I just came across, actually about a month ago, I was looking through some old books, and this is a book from 1935, and there's a little chapter in there about what they call special disabilities, and this is 1935. And a child may fail to learn to read or spell or achieve satisfactorily in music and yet be of adequate intelligence. So it goes on to talk about, again, this discrepancy between areas of achievement, that they do one thing very easily, but they struggle tremendously with something else. So this type of discrepancy may appear between rather closely related abilities. So you find a child who cannot read, although he can comprehend material read to him, and a child with the reverse condition. So the child doesn't achieve as well as you would predict, and this is a special defect. And so again, it's a specific disability because you would think that the child would be doing better than they're doing. Now, again, he talks about that the clearest expression of this is discrepancies on test scores, where someone, a child again, may obtain scores 9th grade in arithmetic, but 3rd grade in reading. And so you see big discrepancies in terms of academic performance. And what's interesting just about this too, then he lists the different kinds of learning disabilities, essentially, that there's disorders of attention, there's perceptual disabilities, trouble with memory, word blindness or alexia, reading and writing problems, trouble with speech or writing, aphasia, agraphia, trouble with thoughts and writing, and I love this one, amusia, inability to sing in tune or distinguish musical sounds. So again, if you think back in 1935, singing was an important part of the curriculum. And so there were children being identified as having amusia. Not as important today. So just kind of brief little review of histories. We see again that there's this concept of specificity, that this is a specific problem. It is not an intellectual disability. It is not mental retardation. It's a very specific problem. So oftentimes, again, people talk about specific learning disabilities to indicate this is not a general learning problem. This is a problem in one or two different academic areas. And typically, again, the main one we'll see is reading. This is a good book to read if you want to learn a little bit more about dyslexia, Sally Shaywitz's book, Overcoming Dyslexia. It's also a nice book to recommend to parents when they want to know more and want to understand more. She's got some very simple chapters explaining what's happening in the brain and what's going on and why there's this problem. And then she also, again, talks about treatment. But she says that the diagnosis of dyslexia is as precise and scientifically informed as almost any diagnosis in medicine. Okay, we know how to identify dyslexia, we know what it is, we know what it looks like, etc. She has then just brain scans in there and things showing too what parts of the brains essentially, and whoops, you have a copy of that in just your handouts, but she shows again the different parts of the brain where there's difficulties. One area in terms of sounds, and then the word form area in terms of the rapid perception of visual stimuli. And so there can be problems in one and or both area, and she shows again what's happening and going on in terms of the neural signature for dyslexia in terms of what's going on in the brain. So that's just explained very clearly in her book and things like that, but it actually shows again that there's a neural basis for many of these reading problems. Now, it is kind of interesting when you look, she says the diagnosis of dyslexia is precise and scientifically informed as any diagnosis in medicine. If we look 1917 Henshelwood, he said, with the possession of knowledge of the symptoms, there's little difficulty in the diagnosis of congenital word blindness when the cases are met with, since the general picture of the condition stands out as clear-cut and distinct as that of any pathological condition in the whole range of medicine. And again, that's 1917. So Dr. Shaywitz talks about her sea of strengths model of dyslexia, where there's a specific problem in word reading and spelling. It's oftentimes surrounded by a sea of strengths. The person has good reasoning ability, good concept formation, a good vocabulary, good oral language. And lots of times no one predicts the child's going to struggle in school till they actually start school because the child's verbal, speaks well, etc. Okay. I think this is one of Gary Larson's best cartoons, School for the Gifted. But it just reminds me a little bit, again, of learning disabilities, because many of these children are so bright in some ways, and then they struggle so tremendously in other ways. Okay? So what we see is that many students with dyslexia have trouble with speech sounds and phonological awareness, which results then in slow word perception, trouble perceiving words quickly. Then they have trouble developing instant word reading, and oftentimes, again, poor spelling that persists into adulthood. So Brad's in 3rd grade, and so he writes, "E.T. phone home." But when you look at that again, you can see that Brad is confused in terms of speech sounds. He either doesn't know the sounds or he's having trouble distinguishing the sounds. So if we look at the symptoms of dyslexia, we see lots of difficulty learning letters, learning sounds, very poor phonics skills, so trouble pronouncing words using phonics, poor spelling that persists into adulthood, slow reading speed, again, and poor spelling into adulthood. So even as adults with good help, people with dyslexia tend to read very slowly. And that's why it's critical that they're given extended time on exams and things like that, because their reading rate is not in line with their intelligence and thinking ability. So it's pretty critical that these students get accommodations on high-stakes tests. I thought this was kind of an interesting description. It says it was as if he were driving in a NASCAR race in first gear while everyone else was cruising along in fifth gear. And that's what these kids feel like a bit. It's like everybody's going so quickly in terms of reading, and they're struggling so much. Now, we also have students, too, that have very severe dysgraphia, and this tends to be more of a written language problem than a reading problem. This boy is in third grade, and he's writing a note to his teacher. He writes at the top, Dan, and he says, "I'm sorry I made you mad. I'm sorry I made you mad." So just a little example in terms of this young man. His biological mother was 14. She was possibly doing drugs. Little information about the father. He had casts on both legs in fourth grade. Results from an MRI showed mild dysplasia in the cerebellum, essentially. But just as he goes through school, so this is what his writing looks like in fourth grade. And as you can see, it's barely legible. So what do you want to do on the weekend? I want to watch TV, play Nintendo, and fall down the stairs. Lots of trouble with balance, lots of trouble with motor skills. And by fifth grade, this is what his writing looks like. Now, this is a note to his teacher. He says, "Dear Miss Toll, I'm Dan. I have a problem with handwriting. I'll be using an AlphaSmart for some of the school year. I will tell you more about myself on the first day of school. Thank you for the letter." The teacher had written a letter asking him to tell her something about himself. You can imagine how Miss Toll felt when she got this letter. But you can just see the tremendous difficulty that he has. So we see motor problems with the boy, both in terms of gross motor skills, fine motor skills, and very severe dysgraphia. Now let me just show you here. He's at a doctor's office doing a test.
And this time I want you to do 2 times on that foot, 3 times on that foot. That's a pattern. Do it 3 times in all. Good. And now next time I want you to do, okay? It takes a lot of work. Hopping is not your strong suit. No. No. Fortunately, I can't think of a single job in which you'd need to hop. And I don't think they even require hopping in school, do they? No.
So hopping is not your strong suit, clearly. But what's interesting, again, about this boy, he's an excellent artist. So, it's just obviously a different part of the brain and things like that. But his art is fantastic, and so it's just you see, again, these sort of differences in abilities among these kids. Now, we do have a subset of kids who have learning disabilities in mathematics, and it's only math that's difficult for them. So find X. Here it is. Yeah, that's about right, huh? So not nearly as much is known about children with problems in math as reading. Reading has been very carefully researched, but there's a lot more attention to math than there used to be. So one of the things, again, that we'll see failure to learn to read, as others do, it's a catastrophe in a child's life and results in lots of emotional problems and psychological problems as well. This boy's in 4th grade, and I asked him to write about what he likes about school. School's fun at recess. School's fun at recess. This is the boy we just watched in 3rd grade. He was trying to write something, got frustrated, ripped up his paper, then he scotch taped it back together, and he wrote on top, "Sorry, I ripped it," when he came back in from recess. But you can just see what difficulty these children are having in terms of writing. Maria's in 8th grade. She says, "I'm so stressed out with school. I can't write. I feel like I'm not good at anything. My self-esteem is so low." And then this was one that I received just a couple months ago. I was at a conference, and a woman came up and tapped me on the shoulder, and she said, "My son wrote this." She said, "I think you'll want to see it." And so I said, "Well, thank you very much." And then I opened it about 3 hours later, and Said, wow, this is, he says, today I was so embarrassed in English, I never want to go to English class again. When you said you're going to pass the papers back out, I knew it was going to be bad. I can't figure it out, but the loudest kid in the class always gets my paper. She makes fun of my spelling, she calls my name out in front of the whole class, then she keeps pointing out my misspelled words. All the kids around her laugh and look at me. This is not the first time I've been embarrassed in class. I hate popcorn reading. I just sit there and freak out and can't listen to the story. Then a kid calls on me. I have to say pass or just turn red in my face. I hate English. I hate thinking about it. These journals don't help me and I hate doing them. I'm not going to be a writer as my job, so there's no point in it. Spelling and reading are my disabilities. I get no help to get any better in it. The school doesn't help me, and that's why I hate school and all the kids who laugh at me. School just hurts me. So this is an 18-year-old boy who's a senior in high school, and you just feel like the schools have failed this boy. They failed this boy. He should be doing much better than this. So you can see there's some of these kids who just slip through the crack and they don't get proper help, and they don't get enough help, and they don't get help early. And then they're very angry by the time, again, they leave school and realize it's not a place for them. So we know that students with dyslexia and reading disabilities, they need very intensive support to learn to read, and they need a highly trained reading teacher. And sometimes that's not available in a public school is a reality. So parents have to get tutors or people outside because there's no one in the school that can provide proper help. That's not true of all schools. But Sally Shaywitz, and they have a study, the Connecticut longitudinal study, where they've followed kids with learning disabilities for about 10 years. And they said about a third of the children in the longitudinal study were receiving special help, but this help was often very erratic, occurring sporadically, and consisting of what might be best described as a Band-Aid approach to a gaping wound. So oftentimes we will see that children who are in public schools and have dyslexia do not get the help that they need to become effective readers. And so they tend to struggle again with reading their whole life. They just don't get help. Okay? So, Lassie, get help. Huh? Okay. But when they do get good help, children with learning disabilities make good progress. Now, Joey's in the 3rd grade here, and you can read what he's saying. Long ago, people lived in the home, people hunted for food, and the teacher writes, show this to your mom at home, have her sign it, bring it back, check out 1 and 2, let me know when we can talk. So Joey at this point in time, in 3rd grade, he hates school now. He doesn't want to go. He tells his mother every morning he's got stomach aches. And he's got really bad stomach aches. And he loved school when he started. But again, so oftentimes with these kids, when they're struggling so much, why would you want to go to school? So he did start getting help. He got referred for special education, and then he started getting help. And I went and I saw him about 6 months later, and found this picture in his folder, you know. So his whole attitude had changed again once he started getting the help that he needed. He got 2 years of very intensive reading and writing therapy, and when I saw him again in 5th grade, this is what his writing is like at this point in time. If aliens are real, I'd like to know. Jimmy Carter said he saw a UFO. I don't think a president would lie except Richard Nixon. So I'd like to know if aliens are real. But these children with learning disabilities, again, they have special talents and they can really accomplish anything when they get the help that they need. When they're identified early and when they start getting services in 1st grade instead of 10th grade or 6th grade. So early identification is critical. I'll say just one more example of a boy, Spence, who's a very, very intelligent boy. He's in 4th grade, and this is a story that he wrote. Now, I want you to notice there he's got the word police spelled correctly. He finally learned how to spell a word, and it didn't matter what Spence wrote. Every day, his police came into the story. Even his math problems had the police in them. I mean, everything he wrote was about police because he said, you know, I finally learned how to spell a word. But if you look down at that last line there, you can see he's got again spelled 4 different ways. You know, again and again, again and again, and they're all pretty good sound spellings, okay? So what you can see is he's having a hard time remembering what words look like. So this would have been called word blindness back in 1904. But and you look at his spelling, the words are like they sound, exact, E-G-Z-A-K-T. That's exactly like it sounds. And so he hears sounds okay. But he's having, again, he's in 4th grade. He doesn't know they has an E. He doesn't know there's an E on the end of have. He's got a backward J on just. And this is a very, very bright boy. And Jupiter's made of gas and maybe Venus, and you've got to watch this last sentence. In the future, people will live on Mars. But when he is allowed to dictate something into a tape recorder, his story about space went on 12 pages. His teacher then typed it up for him after he dictated it. He knows a lot about space. This is an amazing fact. I never knew this until 2nd grade. He's brilliant. So we see again these kids who are very, very smart and have such difficulty with learning. I'm going to just play, Spence came and talked to my class, so I'm just going to play a little bit of him talking.
We'll say this is one writing, so I'm writing this.
Can you hear it?
It's over for me to the side. I kind of do this. So you
turn
can
up the
see
volume?
how
Does anyone
horrible
know?
my spelling was. My letters that were huge.
I want you to hear this, so let
And I
me
look
see
over
if
at
I
the other
can.
kid.
I have some other speakers here. Let's see, that over. Okay. Okay.
We'll say this is one writing, so I'm writing this. Kid peeks over from me to the side. I kind of do this. So you can see how horrible my spelling was. My letters, they were huge. And I would look over at the other kids and I would see that their writing was very neat under control. And then I look at my handwriting and kind of want to hide it.
In your handwriting, did you have the choice whether or not to use cursive? Did you always have to use cursive, or could you?
When my printing's as bad as my cursive.
But I'm more comfortable with cursive.
Yeah, I feel more comfortable with printing. I can read it better too. So multiplication was extremely hard for me. Just like spelling, I felt, what is this doing to me?
Do you have it now?
What?
Multiplication, do you understand it now?
Yes, I have a better understanding of it. And then I'll show you how to do it. Is my 5 backwards after that?
This way. Why do you think that is? What?
Probably just, again, my handwriting errors. One big socket letters.
It's just a little hard to remember which way to
Yeah.
put it, the number.
But then see, at first they thought that it was only a physical problem. Nothing like what it is, really.
What is it?
It's learning disability. I can't spell, I can't write right. I'd make a good doctor.
But you can just see the discrepancy between this boy's verbal abilities and reasoning skills and the trouble he's having with written language. Now, he actually reads 3 years above grade level, so he's a very good reader. So this would be a problem with dysgraphia. So, so just in kind of conclusion here, that learning disabilities are real, and methods used in public schools are not necessarily going to accurately identify children. RTI shouldn't be the sole method for LD identification in schools. Ability achievement discrepancies don't mean that the person has a learning disabilities, but they're trying to reflect the concept of unexpected underachievement. And these children really do need comprehensive evaluations from a good psychologist or a good learning disability specialist to understand and identify their needs and decide which interventions will be most appropriate for these kids. Okay. All right, so this is our quick overview of learning disabilities, but would you have some questions you'd like to ask? Yes.
What would you recommend to parents who are maybe lower on the socioeconomic level and can't afford to get their kids private tutors and all of that?
So what would we recommend when kids are, lower in terms of socioeconomic, they can't afford tutors, and it's a really sad thing because there's really not much available for those children, and so it's really sad. But I would just try to work with the schools to try to get as much help as you can from the schools. But there's not much of anything available if you can't afford to pay for it, and so.
Legally, what are they required?
Well, the schools are supposed to provide what the child needs on his individual educational plan. That's supposed to be specified. So they could put on there that the child needs tutoring each day for 40 minutes, Sometimes, again, though, what's on the IEP doesn't necessarily happen in the school. Sometimes it does, but sometimes, again, too, the schools don't have teachers that are well-trained in reading disabilities. They don't have any training in reading disabilities. So you may have a teacher who's done teacher training for children with severe, profound disabilities, and then they go to a school district and they get a job as a learning disability teacher because there's only one child in the district that has severe, profound disabilities, and they have no background in learning disabilities. And so you can run into situations, too, where the teachers don't have the proper kind of training that they need, and they want to help, but they don't know how to help because they haven't encountered these difficulties, and so they don't know what to do. So a good teacher is critical for these kids. These kids can't afford a year of a teacher who doesn't understand them. They really can't afford it. So it's critical to make sure these kids get really good teachers, knowledgeable teachers. Yes?
We try to teach our trainees, when we have kids coming, ask them to read or maybe do simple math. I'm not sure if that's the best way of, child psychiatrist or child psychiatry trainees to do the screening. But are there any simple screening tools or something which can be used with kids who are coming to us? Their mental health professional can screen, for learning disabilities.
So screening for learning disabilities, there are many assessments for screening for learning disabilities that would be just simple, like 45-second little reading tests that you could do, or 3-minute type reading tests you could do. So there are some simple screening tools available, and I can email them some names to you. Yeah, just of short things that you can just do in like 45 seconds or so, just that give you some information then regarding the child's reading performance.
The other question comes to my mind, why the school doesn't do this kind of on a regular basis? They do hearing tests, they do eye tests. Why they can't do a simple screening for learning disabilities?
Well, and ideally the schools are supposed to be doing screening for learning disabilities. They're supposed to be identifying children with learning disabilities. And many of them are doing a very good job of that, and some are not doing as good a job, but they're supposed to identify children with learning disabilities and provide services. But one of the things that's happening right now is many children with learning disabilities, they can be very smart, and so they're not the bottom kids in the classroom. And so with response to intervention, it really identifies the lowest 5% of the school population is having problems. So those kids don't fall into that. They're so bright that some of them, again, are getting average grades, and they're, performing at 4th grade level, but you'd expect them to be performing at an 8th grade level because they're so smart, and they don't get help and don't get identified lots of times till they go to college, when the demands of reading become so overwhelming and they have to read so much that then they go get their first diagnosis when they start college. And another thing that's happening, too, is many kids who have reading disabilities, and they've had a history of accommodation all through school, even medical school, then they come to take, some kind of medical test, and they're denied accommodations in terms of extended time on the tests because they're performing as well as the average person. And so then they're turned down in terms of getting extra time for tests. So that's just another big problem that's happening, again, with individuals who have reading disabilities. Yes?
A couple of questions. One issue is you use the word dyslexia for the reading disorders, and it seems that that's a bit of a controversy. Some people would not use that term. You're comfortable using that term?
Well, I'm comfortable using the term dyslexia, and dyslexia and specific reading disability are used interchangeably. And so schools would tend to use specific learning disability. They wouldn't use dyslexia. Dyslexia is more of a medical term, and so they wouldn't use it. But I'm comfortable using dyslexia because I know what it is and I know what it looks like, and I think we call it what it is. And it's oftentimes, again, a relief for parents and children to know, well, that's what I have. I've got dyslexia. No wonder this is so hard. And it takes the mystery out of it. It's like, oh, I guess, you know, it's so good to know that I really am smart. It's just that I have dyslexia. And then they understand, again, what they need and the kinds of accommodations. And, again, many of these students need, too, to learn to be an advocate for themselves so they can say to the teacher, I can't copy things off the board. I need a copy of the notes, you know. It's so they can start advocating for themselves. And so, but specific reading disability is also used in terms of synonymous with dyslexia. So.
Parents often see that as being, the lay people sometimes see it as just turning the letters around or transmission to letters, but it's a bit more than just that.
Yeah, absolutely. So sometimes the public just associates with dyslexia with reversing B's and D's and, you know, things like that. And it's much more complicated than that, although that is a symptom in some cases. But it's much more involved. And oftentimes there's a lot of other things, like the child has trouble skip counting in math because they can't remember the number they just said before. And there's lots of other things that can be going on besides just the poor reading.
Is there a theory about why there's such a common connection between ADHD and reading disorders or language-based disorders?
Okay, and so in terms of the comorbidity between ADHD and learning disabilities, part of the theory is, too, that the same neural networks are involved, and so that there's really the parts of the brain that aren't working or working differently. It's the same source, and so that lots of times they attribute it to the same neurological problem. But, yes?
Could you say a couple of words about two things? Dyslexia and learning disabilities in other cultures and languages.
Mm-hmm. Yes.
I have the impression it's particularly hard in English, because our language is terrible
Right.
in terms of the match between what is said and written.
Right.
And also the influence of computer technology. Has it made it any better?
Right. Okay, so first question in terms of linguistic differences. In languages that have more regular correspondence between the sounds and the letters, the phoneme-grapheme correspondence, there's far lower incidence of reading disabilities. So in Spanish and languages that have much more of, here's the sound, write it down, the incidence of reading disability is much lower. It still exists because there's kids with word perception problems. But we'll see that in languages like English and French that have called what's a deep orthography, there's so much going on, there's a much higher incidence of reading disability than in Finnish or German or Swedish or the languages that are called transparent, because here's the sound, you write it, and so it's easier to learn to read and spell. And your second question, in terms of technology, you know, it's interesting, Dr. Gordon Sherman, I was just speaking to him at a conference a couple weeks ago or something, but he said he thinks the new dyslexia is going to be dystechnia, that's what he thinks it's going to be, that pretty soon it's going to be we will be able to access anything without reading. In fact, like Kurzweil now, they've got a thing, it looks like a cell phone, but you can just scan it over something and it'll read to you what it says. You have a headphone in and it'll read you things. So he says that the new learning disability is really going to be people that can't keep up with technology. And he calls it dystechnia, which is, I think maybe he's got a point there again, because it's coming along now where you can get programs that read everything that's on your screen, that they read everything to you so that reading won't be such a barrier as it's been, that's the only way you can access information. Okay. Yes?
I wonder, I many times see students for ADHD evaluation, and they come, and sometimes the histories that their attention problems are more specific, let's say in math class and but not in reading, or vice versa. And the schools insist that first the child needs to get treated for ADHD before they do assessment for learning disability. I wonder what your thoughts are about that.
So, I mean, lots of times, again, in terms of the school thinking that first you've got to take care of the ADHD before they want to assess them. And ideally, they want the children to start medication, and so that the assessment will be more valid of the child's abilities than when he's off or on, you know. So it's usually an issue regarding medication and the effects of medication. The reality is you can do both at once, or you can do learning disabilities, you know, kind of like screen for that, and then you see, gee, there's some pretty severe attention problems that have to be resolved first, you know. So it just really kind of depends on the child and things and how severe the attentional problems are. But I think when they say that, what they're thinking is we want to see what happens when this child starts medication to see if there's an improvement in academic performance when they can focus and concentrate in the classroom. So that's what they're thinking, but yeah. Yes?
Hi, back in the area of technology and learning disabilities, I know that there are some computer programs designed to help children who have, for example, a specific reading disability. Do you recommend any of those to parents or families?
There are a lot of great programs out there to use with children with learning disabilities, and it really depends on the age in terms of what programs there would be, but there's a lot of great software out there. One example, like for children's age 6 to 8, is Read, Write, and Type, which teaches keyboarding, phonics, reading, writing, typing all together, and it's got a very good research base. I mean, so there's a lot of technology and programs that are available, but it really kind of depends on the age of the person. And I had one mother, I recommended a program, and she doesn't allow her kids to use computers because she says they suck out your brain. And so she says, you know, no television, no computers. And I said, well, this program would really be beneficial. And she says, no, they're not allowed to use computers till they're 12, you know, because it will suck their brain out. So anyway, but it's been fun to talk to you all, and thank you.